Hi, I'm Heather, and this is Michelle from Vital Fitness Holistic Center, and I'll be assisting her in teaching you the Happy Baby technique.
Okay, Happy Baby pose is really great. It's really great for digestion. It's great for lower back pain. If you spent a lot of time sitting, it helps to squeeze in the psoas muscle, which I will show you once I have her laying flat. Go ahead and lay down. So your psoas muscle connects right up in here underneath the ribs, right on the spine, and then it connects right here on your thigh. And it's on both sides. And so if you spend a lot of time sitting, when you go to stand up and you feel that lower back pain, that's where that back pain comes from, is this muscle thinks that it is supposed to stay short. And so it doesn't realize it's supposed to elongate. So sometimes when you compress a muscle, it can help you a little bit better. So what Heather is going to show you today, oh, you have your hair thing in. You might have to take that out. So that was really actually a good thing to happen. So if Heather has a hair thing in, then it's going to push her neck up further, and it's going to push her chin into her chest. Whereas now you can see that her chin isn't pushed into her chest, because the goal for her is going to be to flatten this part of her spine as well as flattening the lower part of her spine. You can do this on a bed if you are really having a lot of trouble with lower back pain. It's great to do when you first get up in the morning, but I do also recommend to do it on the flat floor to be able to get the most elongation. In the beginning, or the elongation of the spine, in the beginning you might not be able to. So go ahead and pull your feet up. She's gonna, oh, should we do one at a time? Let's do one at a time.
Okay.
Go on the inside. So the ultimate goal with this is she's gonna pull the foot up, and she's going to want a 90-degree angle. Go ahead and pull that knee into the armpit. So you're not going to go over your stomach. And I'm going to have her pull the other leg up as well. She wants to be on the inside, and she wants to be right on the arch. You can see where her fingers come right across the arch, and you can see this right here. She's not quite 90 degrees, but I know that Heather can do this. She's pretty flexible. So go ahead and pull down. And I want you to push your hips into the table, and I want you to push your spine from your neck and the cervical spine into the table as well. And while she's doing this, she's going to take good deep breaths. If she feels that this is a little bit too easy, then what I want you to do is when you do an exhale, I want you to pull your knees in closer. And then when you inhale, go ahead and pull your feet into you. Exhale when you pull your feet into you. And then push your spine down lower again. And you can see that little shift that she has in the spine. Go ahead and do that again. Push the hips into, push your sacrum right in, and then push your neck down. Push your feet up towards the ceiling. You want the flat part of your foot to go right to the sky. There you go. Nice adjustment there. Now, Heather's really flexible. So for her to get in this position, that's great. This might not be your position. Go ahead and relax and slowly take your legs down. Drop your feet right here, and then slide your feet out, because you don't want things to go into a spasm when you're done. So some people might have a little bit more trouble. She's a great demo because she can do the advanced as well as the modified. So when you first start out, you might need just 1 foot at a time. So what she's going to do is she's going to take this towel, and you're going to loop it around just 1 foot. Loop it around that one, okay, so they can see the... And so you want it right around the arch, not the ball of the foot. And then she's going to pull in, and I want her shoulders to come back into the table. You could see how easy it was for her to pull those shoulders up and come back. Now, if you're having trouble getting your leg where it is, where hers is, you're going to go up a little bit. She's going to try to relax those shoulders, try and relax her head. She's going to pretend this whole time that it's a really relaxing procedure. So she's going to take a good inhale, and then she's going to exhale and pull that knee in towards the armpit. Now, if you're having trouble and you feel like I just can't get any further than this, then even at this position, she's going to go ahead and push up to the ceiling and try and get that 90-degree angle, even if the leg won't come close, and push up. And then when she exhales, she'll find that a little bit of movement will happen there, a little bit closer. Now, once she gets further along, go ahead and take a good deep breath in and exhale on the way down. You can also use a strap like this. I'm going to have her use one of each. I'm going to have her use the towel in the back now because she already used the towel in the front. And then I'm going to have you use this. I'll help you with this one on that left foot. So, and then switch hands now on the inside. So you always want your hands on, when you do it with the, there you go. When you do it with the strap, she's right. You want to be on the outside so that you can pull it in. Then I'm going to help give her, so when you do both like this, if you're having trouble reaching, because you want it to go, you want your knees to go in toward your armpits, she's going to slowly pull down. She's going to find the most comfortable spot for her hands, and she's going to let that neck relax again. She's going to try and hit that 90-degree angle, and then again you'll push up. And now I actually can see a view that you can't hear, where this one knee, her right knee, is out a little bit. So pull those in towards your armpit a little bit more. Push your hips down into the table. Push your cervical spine into the table. And then make sure your shoulders are relaxed. And then she's going to go ahead and push up to the sky. Take a good deep breath and then pull those knees into the armpit. You can even open, bow out, or wing out your arms a little bit and push your hips back down. Take a good deep breath. And the great thing about using the straps and the towels is that she can assist herself coming down. So what I want you to do is I want you to keep your knees bent and then put the flats of your feet down on the table. There you go. Now go ahead and slide your feet out. Just leave that strap there and just slide your foot out. And this is one of the most important parts, is her getting a savasana afterwards. When you get a savasana afterwards, it's going to help to realign everything. It's going to help it to settle in. It's going to help it to relax. So, like I said, this is great for digestion. It's great for lower back pain. It's really good for migraines as well. What did you notice it for? Anything that I didn't?
My hips.
Oh yeah, it's a hip opener. So what it'll do is it will actually allow her hips to open up, but it pushes into the SI joint. And so at the back of your hips right in here, you have where your sacrum is going to be connected to your hip. There's a little spot in here in the SI joint which pinches. And so when she's doing that, that opens it up like this, and then it pushes it in, and that compression can help the area to relax a little bit. It can help that fascia to start letting go. There's a lot of fascia on your sacrum that you definitely want to have. You can't stretch that fascia without, it'll start to tear it over time. So if you compress it and let it go, then that opens up the dam. So when she lays down flat, now she has her fluids flowing more freely. And sometimes you might even feel your feet go numb when you do it or after you do it. If your feet are numb after you do it, then do it again one time. It's good to hold this pose for about a minute. You can even hold it for 2 minutes if you need to. When you're holding it for 2 minutes, make sure you're doing that push up to the ceiling or to the sky to allow that pumping motion to happen. That pumping motion will help to compress, decompress, compress, and decompress in the hip area. Thank you, and you can contact us with the information below. If you have any questions, always feel free to reach out to us.